Okay, we are live on YouTube.
Okay, yeah. Do you want me to wait
We can wait
until
for, yeah,
a
until
couple
12.
minutes?
Or even
Perfect.
if nobody is there, we can wait a little longer also. It's fine.
Yeah, for sure. I'm in no rush, so we can wait and see if anybody joins here.
Sure. Yeah, it's 12. Do you want to start or do you want to wait for a little bit?
No, I can start, and then if anybody joins
Yeah, I
the
will
call.
let everybody on who comes.
Perfect. All
Yes,
right.
thank you.
So, my name's Megan. I am with Muscular Dystrophy Canada, and I'm here today to talk a little bit about who we are and what we do. So first off, I'll kind of give a little background about what Muscular Dystrophy Canada does and who we are. So our mission and vision, the mission that we have is to enhance the lives of those impacted with neuromuscular disorders by working to provide support, resources, and also searching for a cure. And our vision is to find a cure for neuromuscular disorders within our lifetime. So our values are determination, courage, passion, and caring. And the strategies that we have to try and reach our vision and our mission is to invest in research initiatives, provide meaningful programs and services to help fill critical gaps, and to advocate with and for our community for changes to public policy. So just a little overview of who we consider our clients and who we work with. So our clients would be a person affected by a neuromuscular disorder and their families. But we also work with healthcare professionals, researchers, and clinicians, different partner organizations. We have chapters, networks across the country, volunteers, the firefighters all across the country help support us as well with fundraising and raising awareness. And then we have donors. And then we also work with government advocating for changes to public policy, more funding to come available. We work with the healthcare industry, along with advocates and the media. So a little bit about what a neuromuscular disorder is. Our name can be a little confusing sometimes. Being called Muscular Dystrophy Canada, we actually cover around 200 plus different types of neuromuscular disorders, not just muscular dystrophies. So a neuromuscular disorder is either a health condition that can be caused by mutations in the genetic code, or there is a couple diagnoses that we cover that are results of changes to the autoimmune system that impact muscles or nerves. So the neuromuscular disorders affect the peripheral nervous system and the muscular system. A few of the ones that we cover here affecting the peripheral nervous system is the peripheral neuropathies, the lower motor neuron diseases, muscular dystrophies, of course, myopathies, and then a few affecting the neuromuscular junctions as well. So as I said, we have over 200 neuromuscular disorders that we cover. A few of them are here: Duchenne muscular dystrophy, Guillain-Barré syndrome, limb-girdle muscular dystrophy, Pompe disease, myasthenia gravis, spinal muscular atrophy, myotonic dystrophy, inclusion body myositis, Charcot-Marie-Tooth, and hundreds of others. If you're ever unsure if you have a diagnosis that we might cover, or your healthcare provider and you're unsure if it's something we can cover, feel free to reach out to our team and we can give you an answer if it is one that falls under our umbrella or not. So anyone can be diagnosed with a neuromuscular disorder at any age. There's folks getting diagnosed as soon as a couple of weeks after birth, all the way up until their 70s, 80s, still getting diagnosis. Any gender and any ethnicity can be impacted with a neuromuscular disorder. No two neuromuscular journeys are the same. Even folks that might have the same diagnosis can experience it very differently, including how they are diagnosed, treatment, and life experiences. Again, here's a few more of the other diagnoses that we do cover. We like to say that the diagnoses we cover are individually rare, but when you put all 200 plus of them together, they collectively are common and impact a large number of Canadians. So just a couple of the common symptoms we see, but of course there is many more symptoms than this. Poor balance, muscle weakness, fatigue, drooping eyelids, pain, difficulty breathing, difficulty walking or running, difficulty going upstairs. A prognosis for a neuromuscular disorder varies greatly depending on the different neuromuscular disorder someone might have, but they generally are progressive disorders, so they do worsen over time. Some people might transition to different mobility aids, might require a ventilator to breathe, and some people might be on lifelong treatment. So a few of the different treatment options. So there is currently no cures for any of the neuromuscular disorders that we do cover at Muscular Dystrophy Canada, but a few of them have different treatment options. Those can include different medications, attending rehab or physiotherapy, exercise regimens, different diets and supplements, surgery, orthopedic management, psychological management. So if you do have a neuromuscular disorder and you're curious about treatment options, reach out to your healthcare provider to discuss them. And if they have questions, they can always reach out to our research team about some of the current best practice treatment options. So now I'll go into a little bit more about Muscular Dystrophy Canada's services and supports and how to access them. So we have 3 pillars that we offer to our clients, including research, programs and services, and advocacy. So who are our clients? Of course, a person with a neuromuscular disorder would be considered our clients, as well as their family members, but it also can include caregivers of a person with a neuromuscular disorder, healthcare professionals, friends, educators. So how to get registered? A person with a neuromuscular disorder, their family, friends, caregivers, and healthcare providers can all register by completing our online registration forms. That can be found right on our website. But if you are unable to find it, feel free to reach out to me. My contact info will be at the end. For someone with a neuromuscular disorder doing the registration, we do require a healthcare provider to confirm the diagnosis. If a client is still awaiting a diagnosis, because we know it can be a really long process, sometimes takes years for someone to get an accurate diagnosis, but they still need support in the meantime, we're happy to help connect them to a specialist or the genetic testing opportunities in their area to help speed along getting a diagnosis. A few of the benefits of registration: in order to access any of our programs and services that I'm going to talk about next, as a person with a neuromuscular disorder, you do need to be registered. But you'll also be notified of any events coming up, updates on research and treatment, clinical trials that might be relevant to your diagnosis. As a healthcare provider, if you become registered, that means you can access our evidence-based information, contribute to research going on, stay up to date on the clinical trials and treatment advances, and there's also opportunities for multidisciplinary connections. And as a family member, friend, or a caregiver, it means once you're registered, you can attend events like our family and or caregiver retreats. You can also access support such as emotional support to help navigate your loved one's diagnosis, as well as our research hotline, and access really any of the other supports that a person with a neuromuscular disorder can access. As a family member, friend, or caregiver, you can access all that info as well if you're registered. Registration is valid for your lifetime, so once you do it once, you're registered forever. There, of course, is no cost to register. So looking into our programs and services, we have our equipment program, our community connections, our knowledge sharing, and our system navigation. So first, I'll talk a little bit about our equipment program and assistive technology program. So our equipment program provides encouragement to individuals impacted by neuromuscular disorders. This is one of the highest priorities for individuals living with a neuromuscular disorder. Our program is entirely donor dollar based. So we do ask that if clients are eligible for government funding, private insurance, that they exhaust those funds first. And so the equipment application process, we have an online application portal involving a healthcare provider letter of recommendation. So that can come from occupational therapist, physiotherapist, doctor, depending on the specific equipment that you are applying for. It might have to come from a certain healthcare provider. Sometimes it could come from any number of those healthcare providers. We also ask for 2 medical vendor quotes And then there's also a few questions for the client to complete. Again, required to apply to government funding and private insurance if eligible. We also ask that if clients are eligible for any other charitable funders, that they do apply for them for coverage or cost sharing with us, since we are a funder of last resort. If clients aren't aware of any other funders in BC or their specific part of BC, I'm happy to navigate the different funders to see if some of them are eligible. Our program does not have an income cutoff, so we don't require any financial documents from clients. Some of the other charitable funders out there do have income cutoffs, so that could make some folks not eligible for those other funders based on income. So kind of the core of our equipment program is the medical equipment funding. This can be any of your typical kind of medical equipment, like mobility aids, ankle foot orthotics, hospital beds, lift systems, bathroom safety equipment. We do have a $3,000 per piece of equipment maximum, and our minimum is $200 for the cost of the equipment. We can only fund the same piece of equipment every 5 years. So if it's within 5 years that you're looking for a new piece of equipment, but it's the same one that we've already funded, we might not be able to fund it again, but reach out to me and I can go over your situation on a case-by-case basis to see, again, if your situation has changed, that kind of stuff, we might be able to make an exception within the 5 years. We also have a home adaptation part of our equipment program. So through this, we can help make home adaptations that will make clients' home more accessible for them. This could include things like door widening, walk-in showers or roll-in tubs, getting a walkway paved outside, roll under countertops. You can apply for one home adaptation every 5 years, and the maximum for that is $3,000 as well. And then we have our assistive technology. So this is the type of equipment that would be able to improve somebody's health, safety, independence, increase their participation in education, working, or their community. It could include things like a smart watch with fall detection or a medical alert service, communication devices, robotic arms or eating devices, smart locks, medication dispensers, smart light bulbs, any of the kind of assistive technology that you might find out there. If you're unsure if it's something that we might be able to cover in the equipment program, let us know. The maximum for this is up to $3,000. However, each individual piece of equipment kind of has its own maximum as well. For example, smartwatches will fund a certain model of smartwatch. And then anything above that, clients are welcome to pay out of pocket for the difference. And then we also can help with the cost of some treatments and services. So massage, physiotherapy, occupational therapy, and respite. Each of these have their individual funding limits as shown here. So massage is up to $400 a year. Physiotherapy or OT, we can only fund one or the other, up to $750 a year, and respite up to $1,000 a year. Again, we just ask that if you are eligible for any government funding or private insurance, that those be exhausted before you come to us for funding. A few testimonials and examples of the impact the equipment program has been able to help people with. So looking here on the left side of the screen, they have helped us every step of the way to help get the equipment we need to keep moving forward as a family. In the middle, having the burden of purchasing equipment and therapy runs our family into the thousands of dollars each month, and having a portion covered was a huge weight off of our shoulders. We know that the cost of medical equipment is a huge financial undertaking, especially when folks aren't eligible for government funding, or the equipment they're applying for isn't covered by the government. There's huge out-of-pocket costs that come with that. So we're happy to be able to contribute at least a portion to help out. Another one here on the top right of the screen, we can watch the birds together now. That was for a piece of equipment that we funded for someone to be able to get a seat elevation on their chair so that they could look out the window with their spouse and watch the birds. Another one for seat elevation in the bottom left here. I can choose the products I want, not what I can reach. So that is That's for being able to get the products on the high shelves at the grocery store. And then the bottom right here, life has become so much easier and more enjoyable with the ramp and van. We can get around without any hassle, and it's made us feel more connected to our community. Being part of events and gatherings is now a breeze, and we're loving the newfound sense of freedom. That was for a vehicle adaptation with a ramp that we helped support the cost of. So those are a few examples of some of the ways that the equipment that we can help fund has been able to impact our clients. And then the next kind of program that we have is our Creating Community Connection section. So this includes our family and caregiver retreats. So these are an opportunity for the attendees to meet, socialize with people who have similar experiences. Some of the people with neuromuscular disorders may have never met someone with the same diagnosis because some of them are so rare. So these are sometimes an opportunity for them to finally meet someone with the same diagnosis, or at least some of the similar experiences. We also will have information sessions happening, leisure and fun activities. It's a chance to get a break from kind of the demands of daily life, friendships, all that kind of stuff. So upcoming, we have, for the first time this year in BC, we are going to be hosting our caregiver retreats. We have 2 coming up, Harrison Hot Springs on the mainland, October 17th to 19th, and Victoria on Island, October 24th to 26th. So these are an opportunity for the caregivers of our clients to get a weekend away. The cost of the weekend is covered by us. We just ask clients to arrange their transportation to and from the retreat. We'll have some relaxing activities, some sessions on how to take care of yourself as a caregiver, as well as some fun stuff planned. And then for next fall, we will be planning to do a BC family retreat. Don't have all the details on that yet, but if you are interested in attending and you are a registered client, you can reach out to me to learn more about that when we have the details finalized. Then we also have our walk and roll events. We do these all across the country, and the ones that we have coming up in BC, we have Burnaby for September 20th and the Nanaimo for September 21st. These are our biggest fundraisers of the year, and they help raise the funds that we use for our programs and services. So if anyone in the Burnaby or Nanaimo area is interested in coming out to them, don't have to be a client to come out. You're welcome to get in touch with me. Then we have our sharing knowledge and information section. So these are our education sessions. We have what we call our muscle facts and accessibility presentations. These are given to school-aged youth, kindergarten to grade 12. We can sometimes do preschool as well if clients find it necessary. And these are to educate the peers on ability awareness, how to be an inclusive peer. They can be tailored to a student's particular needs. We'll work with the client and their family to decide on what information they want shared in the presentation. We can also do lunch and learn presentations, and those are tailored towards the educators at the school, talking a little bit more about the disorder and how to create an inclusive classroom experience. And then we can also do outreach presentations, just like this one, talking about our programs and services to healthcare providers or other service organizations. And then we have our system navigation. So system navigation is kind of what I say is a catch-all for anything we might be able to support clients with, whether that be accessibility issues, accessing attendant home or respite care, visiting at the neuromuscular clinic, education or employment support, emotional support, our equipment program, of course, but also accessing other financial aid, whether that be financial aid for equipment that is above the cost we can support with, or financial aid like accessing government funding, income support, Canada Disability Benefit, those kinds of things. We can help with healthcare provider referrals. We can help with looking into accessible housing, general information, accessible recreation and transportation, as well as navigating the transition from the youth to adult systems, or navigating a transition from living in the community to living in a supported living environment. Really anything that a client might need support with, we're happy to help support it. It's not something I internally can help with, and I'll connect the clients with a community organization in their specific area that would be able to support them better. And then the other pillar that we have is our research and advocacy. So our research department's kind of main goal is to enhance the lives of people with neuromuscular disorders while continually searching for cures. A few of the ways that we do that is through advocacy for accessing therapies and treatments, knowledge translation on different medical studies. We conduct our own internal research. We do clinical trial support for all the different clinical trials happening for diagnosis we cover. We fund some clinical and research fellowships to continue the research happening out there on the different neuromuscular disorders. We also fund other research as well as education for the general public and for medical and scientific professionals. So again, our research priority is to bridge the critical funding gaps, leverage the current funding through partnerships, and advance the engagement in patient-oriented research. We do this through a few ways: through accelerating knowledge, enhancing care, like reducing time to diagnosis, improving rehabilitation and wellness approaches, and raising the standards of care for people with neuromuscular disorders. Through understanding diagnosis and disease progression, as well as discovering treatments. So like I mentioned, we have our fellowship and research grant opportunities. So those are, each year we can fund a certain amount of research grants and fellowships to help invest in the next generation of clinicians and scientists and finding new treatments and therapies. We also have our research hotline. So the research hotline is available over email or phone, and they can help clients or healthcare providers, family members, caregivers with questions about the medical kind of side of things, whether that be about new studies or treatments someone's heard of, clinical trials that are happening right now. They read a recent study and they wanted to explain it in more simple language. They have questions about certain disorders or symptoms that someone's experiencing. We work with a panel of medical and scientific experts, both pediatric and adult, all across the country to help gather that information if clients do have questions. Then we also have our webinars. So we offer 1 or 2 webinars per month. Some of them are disorder specific. Some of them are more general topics related to all neuromuscular disorders. And all of the past ones do get recorded on our YouTube and can be found on our website. And then we occasionally also do our own internal research. So one of the things that we've been doing is called journey mapping. We did a journey mapping for myasthenia gravis that was completed a year or 2 ago, and we're working on another one currently. The journey maps kind of look at the individual's kind of their experience with getting a diagnosis, accessing healthcare, all those kind of experiences, and we put it all together to show kind of, how long it takes for someone to get the diagnosis and the lack of information that might be out there about that diagnosis and how they can access treatments or not access treatments. And then we can use that information when we go advocate for more information regarding diagnosis, earlier diagnoses to be out there. We also recently did a study looking at the cost of living with a neuromuscular disorder, and that was more so looking at the hidden costs. So kind of things like people having to take time off work to attend appointments, whether that be the person with the neuromuscular disorder or their caregivers, family members, all those kinds of hidden costs related to having a neuromuscular disorder. And then that information is taken when we go advocate to government for more funding to become available. And we also have our advocacy, we call it kind of our change agent. So one of the big ones and a big win in the past few years was the newborn screening for spinal muscular atrophy. A few years ago, there was just I believe it was 2 provinces that were currently screening for spinal muscular atrophy at the newborn panel. So when a baby is born, they get the prick and the blood panel is done. Now, as of last year, all across Canada, every province and territory is screening for spinal muscular atrophy. This means that when a baby is born, they get the test, they'll receive the results within a few weeks of having that test, and they're able to start treatments before they even start having any symptoms. This means that babies that previously might not have been hitting milestones like walking, running, sitting up alone, they're able to start reaching those milestones, and babies who previously may not have lived to see their second birthday are able to not only live to see those birthdays, but also hit the milestones. So that's a huge win for the neuromuscular community, and Muscular Dystrophy Canada helped with the advocacy along with other community partners all across Canada helping advocate for that. We also helped with the Disability Inclusion Action Plan. We do patient drug submissions. So we have a few different kind of system level advocacy projects that we've worked on. We also have our individual and self-advocacy. So individual advocacy is kind of the advocacy that someone themselves are experiencing, they might need support with. Could be employee or employer concerns, housing, access to home care or other healthcare services, transportation issues, kind of an individual level of advocacy that we can help with. And then we also have our self-advocacy toolkit for clients that are looking for some tips and ways to be self-advocates for themselves. If anybody's interested in accessing that, I'm happy to send it along. So that's kind of the gist of our programs and services. I know we don't have anyone with us live right here, so I don't know if there would be any questions, but if anybody does have questions that come up, people are free to reach out to me over email or phone at any time.
Yeah, great. Lot of good information. Yeah, somebody might contact you because you have your email and phone. So
yes, absolutely. Anybody, clients or not, is welcome to reach out, and I'm happy to answer any questions.
Okay.
Awesome.
So you want me to end it?
Yeah, that's all I have on my side.
Sure. Thank you so much for the presentation.
Thank you.